one of the lessons I think that we have all realized is when, in times of crisis, what you build on are the networks you build in good times. It's the relationships you have, people you trust, people who care about you and you care about. So networks are extremely important. That was the first lesson I think we all have learned.
Cancer care has been put on hold, no matter what we can say here. The treatment has been done or not done in a total disruption of families. What we see is that there are some cases which have been unfortunately treated very late, and we have just had Roman saying there will be many deaths. So let me say, for COVID, it was clear that there were millions. Then everybody has different reports, 8 million, whatever. I mean, it depends on where you put the cursor, but many of the cancer patients in Europe did not get that treatment because of COVID. So it was not a war, but we have a clear perception that when there is disturbance, cancer is one of the first diseases that disappears from the screen because the patient, has other moments of urgency.
And it's important to keep the momentum going. So cancer and healthcare in general has become one of the focal points in Brussels bubble. It wasn't before, but now it is. But because of all the other topics like inflation, wars, higher prices, etc., I'm afraid that we are beginning to lose this momentum. And this is why these kind of initiatives are so important. This is why it's important that we have European Cancer Organization organizing things like this to raise awareness. This is why it's important to have all of you stakeholders involved.
So we need to have a partnership to augment global and European advocacy and awareness. And it was said by Tomislav that, it's a threat, things are happening. Then suddenly this priority is lost. It has to be nurtured. It's also extremely important to activate at country level. We cannot do this alone. And every country I visit, I'm actually very positively surprised that we have a lot of partners that we actually don't know because we have not been able to align together. And then, of course, it is also to use the international expertise to get the best normative guidance.
We believe in working together to bring about change at the global level. And towards this, we have already initiated discussions on cooperation with the US Cancer Moonshot. And this will not only impact on patients and families in the EU and US, but worldwide. Solidarity is vital to bring about change. Together, by joining all our voices, we can make a difference.